Welcome back. We're officially at the 9 a.m. Time frame, so we are officially 75% through our 24 hours. And it has been a great time so far. And next with us is Dr. George Garrow of Primary Health Network. And Dr. Garrow, I appreciate you coming out of here, taking time out of your busy schedule, and coming in and being part of the conversation.
Well, thank you for the invitation. Thank you for your hospitality. I'm looking forward to spending some time with you.
Yeah, and I tell you what, one of the things that I really appreciate is, I remember when God called me to ministry back in 2020. This ugly thing called COVID popped its head up and just threw everything into a ripple. And, you were one of the ones in primary health that were instrumental with you, plus through the Citygate Network, we talked to other missions, but was instrumental in helping us get through that challenging time. And, to the point that you even gave me your cell phone number and said, hey, I'm available 24/7, just call. And every time I called, you answered. And, because of that and because of, what we were learning from Citygate Network, we were able to not have a positive case of COVID for almost 10 months into that pandemic. And what was even more impressive about that is when we had that first positive case, it was a staff member. It wasn't even one of our guests. But even when COVID worked its way through into our guests, you helped us with the system and we got it in place as far as quarantine. So I appreciate that because right off the bat, it's when we first met. But you really opened up your heart to those that we serve.
Thank you for your kind words, Jack. It has been a great honor for me and for Primary Health Network to have the opportunity to work with you, your wonderful team, your staff, the individuals that you serve. I think both organizations, the City Rescue Mission and Primary Health Network, are so mission focused that there was never any hesitation, any question in my mind that working together is what we were here to do.
Yeah, and I mean, you can just see over the years where that has continued to grow. So what started off as helping us get through COVID turned into a discussion you may had and saying, our guys need to see the doctor. Some of them haven't been to a doctor's office in 10 plus years. And again, when you were looking and we're making a choice between, well, where am I going to sleep tonight? Where am I going to find food? Sometimes the health is not a top priority. So love that we started Community Bridges together, and we just grew that initiative to include other agencies and brought them in after you guys. And, the concept has worked. And, for you guys that don't know what Community Bridges is, we started this back in late 2021, but it was a way to bridge our guests to services that were outside of our walls, but also take those services and bring them inside our walls. And it's been a great success. But looking back on it, one of the main reasons it's worked is, you guys didn't rush into it, say, oh yeah, we'll show up tomorrow with it. We came up with a plan. And the first plan was, let's build trust. And I mean, that was key.
Absolutely, yeah. Jack, over the last 5 years, really since, or even prior to COVID, so many communities within our community have plenty of reasons to have lost trust in public health and health, other official organizations. And, I think a lesson that I've learned really firsthand by working with you is really the value of importance of listening, listening to your residents, listening to your guests, listening to members of our community. First and foremost, listen as an opportunity to try to develop that trust. So, and I would tell you, our partnership and our collaboration working with you has made us a better organization.
And listen, it all comes down to that trust, because the one thing we found with the people that we serve, sometimes they just want that ear.
Sure.
They don't have anybody to hear their stories. And again, that's why we're doing this today.
Yeah.
We want their stories out there.
Sure.
Because these are human beings. They're not statistics. we're living in an age of high need. HUD said back in January, 18% increase in homelessness across the nation. So again, not a Newcastle, not a Western Pennsylvania issue, but a national issue. And working alongside you guys, we're helping address that crisis. And when you guys first brought your mobile unit in, it was great because, again, like we said, there were individuals we had here that hadn't seen the doctor in many, many years. And, just the importance of, hey, do you know you might be struggling with sugar, you might be a diabetic, or, you might have some heart issues we need to look at, whatever those health concerns were, they started to get addressed. And by result of that, our guests now feel better and they have more energy and they're able to, do more things because they took care of their health matters. And Dr. Rumbaugh, as part of your team, has been tremendous.
Yeah. Well, and as I said, we're just extremely grateful for the opportunity to serve. That's what community health centers should be doing. That's what we're designed to do. That's what we're built to do. And I'm just so appreciative of all that you have taught me, and that your guests have taught me about values, love, trust for one another. It's been a really great partnership, Jack. Thank you so much.
It really has. And Nick Barron's coming down a little bit later today to talk more about the mobile unit. Erin was here yesterday talking about her involvement. But what I love about it is you just don't bring that mobile unit to rescue mission, correct?
Correct. Yes.
It travels.
Yes. We one of the things that I encouraged our team to do is I don't want to see that mobile unit in the garage or the warehouse. I want to see it out.
Yeah.
And yes, we're trying to knock on as many doors and open our doors of the mobile unit to as many folks as we possibly can. And as I said, your organization, your guests have really taught us the value of compassion, of trust, and being present.
Yeah. So if there's any other nonprofits out there, I know I got 70 other missions doing this across the country, but for you missions in the Western Pennsylvania area or even into Central Pennsylvania, this is something that you could offer to them too.
Absolutely.
So reach out to Primary Health Network, and love the opportunity to tell you how this has worked here. But it doesn't stop there. We're looking into other stuff. We're doing Mission Connect right now. We just did a sprint design grant with you guys, looking for ways to improve. But one of the things that I'm really enjoying right now, and I had Marla Brown in about 6 o'clock this morning, her and me were talking about it, but the task force that has been put together of various agencies on improving the health of our county. Can you talk a little bit about that?
Yeah, sure. So several years ago, it came to my attention the Robert Wood Johnson Foundation supports research from the out of the University of Wisconsin, and they rank county health outcomes across the entire country. Now, in Pennsylvania, there are 67 counties, and it turns out that Lawrence County, right here, ranks number 65 out of those 67 counties. And when I read that statistic, it just really broke my heart because we have so many wonderful agencies and services like yours that are doing great work. So we pulled a group of interested people together, and I showed the data, and I just simply asked, "Are you satisfied with that?" And the community that was in attendance said, "No, we could do better than that." And so since that time, we've had these series of conversations, and what we've really learned is that we need to work together. We need to think outside of the box. We need to get out of our silos and come together. And I'm going to tell you that Lawrence County is now the model that I'm taking to other regions in the Commonwealth of Pennsylvania to encourage others to collaborate, work together, because that now is our time to improve the health and access to quality health care across the state.
Yeah, and it's something that's key because when you improve the health of a community, the community itself gets stronger, and we're able to help more. And, in this time, we need all the help we can get. So I love bringing all these agencies together. I like us all sitting around the table and just brainstorming ideas. But what's great is it's more than just talking. We're working on bringing some of this stuff actually into practice. One of the ones looking for a way that the agencies can talk more and have more open lines of communication. And that's exciting because it's not just talk, it's actually action.
Sure. I have recently been saying, I'm tired of admiring our problems, right? I'm tired of wringing our hands and saying, oh, woe is us, and, boo. But instead of wringing our hands, let's roll up our sleeves and, let's try something. Let's pilot some things, and it's actually happening right here in Lawrence County.
It is.
I'm really grateful for that. Yeah.
It is, and it's showing how we need everybody.
Absolutely.
We need everybody at that table talking.
Yes.
And that's key.
Yeah, yeah.
So again, I appreciate everything you guys have done. This has been a great partnership. We're looking forward to continuing to work with you guys and look for other ways. I can't wait to talk to Nick later today about Mission Connect, what you're doing of reserving times for our guests here at the Mission to come down to primary health so they can get those follow-up procedures that they need. So there's exciting times because it's not just talk, it's action, and we're seeing results.
Absolutely.
And we're seeing lives changed because we're bringing everything. We're bringing the health, the physical health, we're bringing the spirituality, we're working with other agencies, and you guys also for mental health. Now you do our med management here, which was something we've never been able to offer. But it's bringing all those services and wrapping them around an individual. And when you can meet every single one and touch on it, the percentage of that individual having a transformed life and a stable life increases significantly. So the work we do is very, very important together.
Well, thank you. And as I said before, thank you for the opportunity. You and your guests have been my professors, and you've taught me so very much. And so for listeners who may not be familiar, Primary Health Network is a community health center, also called a federally qualified health center, and the health center movement really started in the 1960s as part of the war on poverty. And the initial health centers in the United States were founded in rural, very poor, underserved communities. And since that time, we've grown and grown to be the largest providers of primary care in the United States. Yeah. And there are community health centers in every community, every county, every state, every territory in the United States. So for listeners, if you would like to learn more about community health centers and the community health center movement, please, feel free to reach out to me or your local community health center. We actually have a state association, Pennsylvania Association of Community Health Centers, with a wealth of information, and on their website it's how to find a local health center. Yeah. And as I said earlier, we are our missions are aligned with yours, and I'm just really grateful.
Yeah. Well, how far is your reach on primary health? How far do you guys reach out?
Yeah, so we're the largest community health center by landmass in Pennsylvania, one of the largest in the whole United States. Last year we served 75,000 patients across Pennsylvania and northeastern Ohio. We're in 17 counties. Wow. From Erie and Ashtabula County in Ohio all the way east to Schuylkill County at the in the anthracite coal region over there, and a lot of small rural communities in between. We go as far south as Westmoreland County, Altoona, Lewistown. We have 46 locations across the state, and I love every single one of them. They're all very different, just like children. You love them all equally well, but they're all very different. And I'm a resident of Lawrence County, so our work with you and the work that we're doing here is truly near and dear to my heart.
Yeah, and your main offices are located right up in Sharon. So it's a nice, easy drive up to meet with you guys, or you guys come down here.
Yeah. Yeah, it's interesting. Primary Health Network was founded in 1984 when the economy of Western Pennsylvania was flipped. When I graduated from high school, the majority of men in my graduating class didn't go to college. They went to work in the mills and the mines, and they were set for life, right?
Right.
And then we all know what happened in the 1980s, and those jobs left. And in our area, in Lawrence and Mercer County, so many folks lost their employer insurance. So the founders of Primary Health Network really saw an opportunity to bring that health center model to this area. And yeah, we're headquartered in Sharon. Anyone who's listening, you're welcome to come and visit. As Jack had mentioned, we have a wonderful team.
Mm-hmm.
I'm honored to serve as the Chief Executive Officer. I joined Primary Health Network initially as the Chief Medical Officer, and that was the best job I ever had until I got this job, and this is the best job now.
That's awesome. Well, you do a great job at it, and again, I appreciate everything you do for the mission. Like you said, our values and the people we serve, it all aligns.
Absolutely.
So
yeah.
it is a perfect fit working together with you. So I appreciate you taking the time to come down here this morning, taking a few minutes to be part of the conversation, and just educating individuals of what we do together and why we do it. So thanks again for taking the time. I appreciate it.
It's been an honor, Jack. Thank you.
Awesome.
Good luck to you.
Thank you.
Thank you.
Well, stay tuned. We got a couple more conversations lined up this morning before we go to one of our national feeds. So stay tuned. We'll be right back.